think kind of going into kind of question to Dr. Sen, where we are right now is basically thanks to people like you, who developed and study cancer for a living. We are just kind of on the tail end, trying to use the drug. What can the patients do to help with translational research? Because our audience is patients, right? So what can they do to help you and eventually help themselves, because this research hopefully will translate with to approved drugs?
Thank you so much. And I would say it's a partnership. Yes, we try to do a lot of the discoveries in the lab, but it's truly a partnership with clinicians like you who take it to the clinic. So I think what the patients can do, and I see it more and more through these events that I go to, that the patients are really trying to understand the biology of the disease. And I think that makes conversations really easy. Another thing that I would urge everyone who's listening is that we need research material from the patients, right? We disease from the patients. So, if there is a consent protocol that you can, if there is a protocol at the institution that you're getting treated, where they're asking for your tissue or your blood, your consent to participate in research, I would really request the patients to do that. If the clinicians are approaching you, understand so much more from the tissue or the blood itself with cell lines or animal models. So for the patients, I think participating in research through their tissue or blood is very important. Another thing is, talking to researchers about the new discoveries. And I think this is where these conversations are so easy and important, is when we break down what we do to what that contributes to. So research is expensive with the funding crunches that we are seeing, and with everything that the research needs. I think advocacy is really, really important, and that I have seen patients with lung cancer do that so much. But really advocating for funding for research is very important, because that's how we will be able to progress in the clinic. So participate protocols in your institutions, learning more about the biology, and advocating for patients with lung cancer.